Good morning. The first item of business is general questions, and at question number 1, I call Rhoda Grant.
To ask the Scottish Government what progress it has made in ensuring that 10% of frontline NHS spending is on mental health services.
Minister Tom Arthur.
We continue to work with NHS boards and IAGBs towards delivery of the commitment that at least 10% of frontline health spending will be dedicated to mental health by the end of this parliamentary session. The latest available cost book data confirmed that NHS expenditure on mental health has increased by £179.6 million to £1.486 billion in 2023-24. That is 9.03% of total net expenditure, up from 8.53% in 2022-23. Whilst we remain committed to the delivery of the target, as we all know, there are continued and unprecedented challenges to the public finances. Despite those pressures, since 2006, mental health spending across the NHS has doubled in cash terms, from £651 million in 2006-07 to over £1.49 billion in 2023-24.
Rhoda Grant.
The Scottish Government pledged that boards should spend 1% of their budget on child and adolescent mental health services. And I understand only one board has achieved that, while NHS Highland is only spending 0.37% of their budget on CAMHS. Yet young people are spending years of their childhood on waiting lists, and others are being rejected from the service altogether. Can I ask, when will all boards fulfil this pledge, and when will lengthy CAMHS waiting times be dealt with?
Minister.
Well, I want to acknowledge the significant progress that has been made on CAMHS waiting times, as members will be aware, this year. Specifically on the points of NHS Highland, I am aware of that and have been discussing the matter actively. My officials have been engaged on the matter, and I want to confirm to the member I will be meeting with NHS Highland in the near future and all of the other territorial health boards, because I want to ensure that we can work constructively and in partnership to make sure all of our health boards are meeting those spending targets.
Brief supplementary, Colin Beattie.
Can the Minister outline how the Scottish Budget, which Ms Grant and her colleagues didn't even engage with, let alone vote for, provides record funding for mental health services across Scotland, and how will this benefit thousands across Scotland to access crucial services?
Minister.
As I set out in my initial response, since 2006, mental health spending by NHS Scotland has more than doubled in cash terms, and the most recent figures show that spend was £1.486 billion in 23-24. Mental health is an absolute priority for this government, and even in the context of the past few difficult financial years, we have continued to invest wisely. That is evidenced by statistics showing that we have the best national performance ever recorded for CAMHS waiting times, and we have record numbers of staff providing more varied mental health support and services to a larger number of people than ever before.
Willie Rennie.
But working towards, when there's only 1 year to go before the end of this government's term in office, is just not good enough. Fife is well down the league table in terms of spending on mental health and on CAMHS, and the effect on other services is dramatic, whether it's the police and on the economy, with lots of people unable to work because this government can't give them the support they need. When is there going to be a renewed focus on making sure mental health is the priority that it deserves to be?
Minister.
I recognise the seriousness of the issues that Mr Rennie raises, and I want to assure him that less than 24 hours in post, I have been actively engaging with my officials to take these matters forward. We have seen an increase in spending on frontline mental health services. That much I've already referred to in my original answers. I recognise and appreciate that there is variation that exists between boards. That is ultimately something that is going to be part of any complex system as we're dealing with. But as I set out in my original answer to Rhoda Grant, I'm committed to meeting with all boards over the course of the summer, because I want to make sure we are all collectively across Scotland working to meet those spending targets by the end of this parliamentary session.
There is much interest in this session. I'd be grateful for concise questions and responses, and I call Fergus Ewing.
Presiding Officer, to ask the Scottish Government when GP vaccination services will be fully restored to GPs in NHS Highland, in the light of reported concerns that the proposed hybrid model is less safe and more expensive.
Cabinet Secretary Neil Gray.
Officer, in general, the model of health boards been responsible for delivering vaccinations is working well across Scotland, but I recognise the need for flexibility to account for specific circumstances that might negatively affect vaccine uptake, such as the areas I have discussed at various junctures with Mr Ewing. That is why I have agreed to Highland Health and Social Care Partnership, putting in place a mixed model. Oversight of how that is developed and deployed to deliver local and accessible vaccination services in a safe and cost-effective way will ultimately remain the responsibility of Highland HSCP, with input and support from local GPs, practice managers, Public Health Scotland and the Scottish Government.
Fergus Ewing.
Presiding Officer, over the past 3 to 4 years, I've raised with the Cabinet Secretary and his two predecessors that a GP-run service would save millions of pounds a year, a fact that the Cabinet Secretary appears to ignore. And more important, it will be safer because, as the Cabinet Secretary well knows, we've already lost the life of one infant because of the negligence of the NHS centralised system. So, given the concerns that this will not even now be returned to GPs for this winter, will the Cabinet Secretary intervene and demand that NHS Highlands return this service to GPs before any more damage and unsafety is caused to patients in my constituency in the Highlands?
Cabinet Secretary.
Thank you, President Officer. I thank Fergus Ewing for his question. I have listened to the interactions that we've had, the testimony that has been provided by him and the GPs that he represents, and have taken action as a result. I'm concerned by the narration that Mr Ewing has put forward at the conclusion of his question around the pace at which this is moving at, and I'd be more than happy to check in again with the Highland Health and Social Care Partnership to ensure that the necessary pace, effectiveness and safety of the system is paramount.
Edward Mountain.
Thank you, Presiding Officer. I've always joined with Fergus Ewing calling for vaccinations to be returned to Highland GPs. But NHS Highland seems to believe that the only place to deliver services is in Raigmore, which is why they've also pulled enhanced GP services across the Highlands. Surely the answer to this problem, Cabinet Secretary, is because NHS Highland cannot manage their finances and appear to be £50 million in debt already by the end of the year, that they should be put in special measures because of these issues.
Cabinet Secretary.
We continue to work with all boards, including NHS Highland, on their financial position. We keep those positions under review, and I know Mr Mountain has an interest, as does Mr Ewing, in the position around vaccination services in Highland. I'm happy to continue to interact with him on that basis to ensure the effective, safe delivery of vaccinations in Highland is achieved, and I'll ensure I keep in touch with Mr Ewing and Mr Mountain to that end.
Question number 3, Michael Mara.
Scottish Government what assessment it has made of the impact of the reduction in Scottish Attainment Challenge funding for Dundee City Council?
Cabinet Secretary Jenny Gilruth.
Since the inception of the Scottish Attainment Challenge in 2015, Dundee and its schools have received a total of £86.7 million. In refreshing the Scottish Attainment Challenge in 2022 to introduce strategic equity funding, the Scottish Government prioritised ensuring that funding was distributed equitably to all 32 local authorities, recognising that poverty exists in every local authority in Scotland. In taking that decision, an equality impact assessment was undertaken and published at the time. The change in distribution was developed in close consultation with local government and agreed to by COSLA, and that has taken place over 4 years, enabling challenge authorities to transition to their equitable share of CEF over time.
Michael Mara.
Several constituents have contacted me as their jobs as health and wellbeing workers in Dundee schools are being cut. They're set to lose their jobs despite years of service at the end of this school term. So in 2021, when the SNP didn't just refresh but cut Dundee's Attainment Challenge funding, I warned that that decision would inflict callous cuts on the poorest children in the poorest areas in Scotland. So what does the Cabinet Secretary have to say to my constituents who have provided such vital support to some of the most vulnerable young people in Scotland for a decade? Will she speak to her colleagues in Dundee City Council and stop these senseless and damaging cuts?
Cabinet Secretary.
Well, I do recall that Mr Mara made commentary at the time in that regard. He said, of course, back in May of 2022, we all recognise that there is what you might call hidden poverty in every community. He also said at the Education Committee in May 2022, he appeared to welcome this shift. He said it's good that the money is now available to local authorities. Fife are up £2 million. And across the piece, of course, we know that throughout the duration of the Scottish Attainment Challenge until 24-25, Dundee had been allocated over £43 million in both Challenge Authority and strategic equity funding. And I go back to my original point, Presiding Officer, that the ask to move our approach in relation to this funding was an ask directly from local government, which Mr Mara appeared to welcome at the time. I'm more than happy to have my officials engage with officials in Dundee City Council to the substantive point that I think the member was making.
Thank you. Question 4 is not lodged. Question number 5, Faisal Chowdhury.
Thank you, Presiding Officer. To ask the Scottish Government how it is working to ensure that schools are tackling racism and racist bullying.
Cabinet Secretary.
I'm clear that there is no place for racism in our schools. Incidents of discrimination or prejudice must be addressed whenever they arise, and it is important that we are vigilant in challenging any racist behaviour in Scotland's schools. In November, we published updated anti-bullying guidance, Respect for All, which included guidance on responding to prejudice-based bullying. The Scottish Government will publish new guidance for schools on responding to racist incidents, including guidance on recording and monitoring in the coming weeks. This has been developed in partnership by the Racism and Racist Incidents Workstream of the Anti-Racism in Education programme.
Faisal Chowdhury.
Thank the Cabinet Secretary for the answer. I recently heard the story of Akhta Marwa. She was forced to remove her daughter, Anissa, from school after months of racist bullying. Despite reporting the incident and receiving an apology from the bully, records were not held. No follow-up work was done and the bullying continued. There are many anti-racist toolkits, but can the Cabinet Secretary tell me how the Scottish Government is ensuring these are actually put into practice, and will she meet with me and ACTA to hear directly about the impact of racism on children?
Cabinet Secretary.
I'm happy to give Mr Chowdhury that undertaking. I'm more than happy to meet with him and his constituent additionally. We know there are challenges in Scotland schools post-pandemic in relation to racism and other incidents being recorded particularly, and of course that speaks to some of the wider work that we are undertaking that will publish before this term ends in relation to recording and monitoring. The Bullying and Equalities module on CMIS, the Schools Management Information System, has a specific recording category for incidents where race was a factor, and CMIS also enables us to record where racism intersects with other forms of prejudice. But I'm more than happy to engage with Mr Chowdhury on this point, and I hope he will take some heart from the updated guidance which we'll publish before the end of this term.
Question number 6, Colette Stevenson.
Thank you, Presiding Officer. To ask the Scottish Government what its response is to the recently published report from the review body on doctors' and dentists' remuneration, which provides pay recommendations for doctors and dentists for the financial year 2025-26.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. Firstly, Agenda for Change trade unions, which includes nurses and midwives, have unanimously accepted a 2-year pay deal of 4.25% and 3.75%. The Independent Doctors and Dentists Pay Review Body has recommended a UK-wide 4% pay uplift for NHS medical and dental staff, and I intend to accept the DDRB's recommendations. This excludes resident doctors with whom I will hold direct talks in the coming weeks. This will see, for instance, consultants' salary increases of between £4,286 and £5,695, and means at the top of their scale a consultant will earn a basic pay of more than £148,000.
Colette Stevenson.
I thank the Cabinet Secretary for that response. I am proud that Scotland is the only part of the UK where both GPs and dentists have seen real terms growth in their wages in recent years, and I am hopeful that this will drive recruitment in the sectors as we continue to improve access to healthcare across Scotland. However, the UK Labour Government's reckless increase to employer national insurance is hitting GP and dental practices hard. Can the Cabinet Secretary therefore please advise what discussions the Scottish Government has had with the UK Government regarding damaging Westminster policies like this, and can he outline how the Scottish Government will work with stakeholders to retain and recruit health professionals in Scotland?
Cabinet Secretary.
Thank you, President Officer. The Cabinet Secretary for Finance and Local Government has raised the increase in employer national insurance contributions repeatedly with UK Treasury ministers and pressed for the additional cost to public services here in Scotland to be fully funded. This is having a profound impact now across Scottish public services, paying for a UK government tax rise. That's our GPs, it's our social care services, our voluntary sector partners, all paying for UK government decisions. So it is incredibly disappointing that the Chancellor has yet again failed to do this in the recent spending review, and we will, of course, have to consider the implications of that as we continue to deliver services for the people of Scotland.
Question number 7, Daniel Johnson.
The Scottish Government, in light of the Strategic Defence Review's emphasis on a whole-society approach to national security, what discussions it has had with the UK Government regarding work to contribute to a comprehensive national resilience strategy?
Cabinet Secretary Angus Robertson.
Thank you, Presiding Officer, and I'm pleased to confirm that there has been ministerial and official engagement before and since the launch of the UK Strategic Defence Review. Defence policy is, of course, reserved, but the security and safety of people in Scotland is a top priority for this Government, and that's why we've taken an active and a constructive role in the Strategic Defence Review process. From its initial stages last year, where the First Minister wrote to Lord Robertson, who led the review on the 30th of September 2024, with the Scottish Government's response to the propositions posed by the SDR reviewers, through to the ministerial discussions that took place in the days before and since the SDR was published on the 3rd of June.
Daniel Johnson.
I thank the Cabinet Secretary for that answer. What is clear is the Strategic Defence Review is far more comprehensive and wide-ranging than probably any defence review we've had in the last 25 years. And there are clear recommendations that have implications in devolved areas. We've heard in recent days arguments and points around industrial strategy, but actually civil contingency is really a clear concern, with recommendations around coordination between civil and military authorities, such as local authorities, health, police and clearly devolved government. So I would be grateful if the Cabinet Secretary could outline what discussions it has had, both with military authorities but also UK Government, to set up the structures required to undertake that civil contingency work.
Cabinet Secretary.
Well, can I give Daniel Johnson the assurance that efforts are underway to optimise relations which will ensure resilience is maximised? And this requires developing existing and emerging relationships between the UK Government, devolved administrations and a range of agencies and departments. And I'd like to give Daniel Johnson the confidence that this is being progressed and that there is a shared interest in doing so, and I'll be happy to update him on that progress.
Question number 8, Jackie Bailey.
To ask the Scottish Government what its position is on the reasons for there being more private hospital admissions in 2024 than in any previous year on record, according to recent private healthcare information network data.
Cabinet Secretary.
Thank you, President Officer. While a patient has the right at any time to exercise choice and seek private treatment, we recognise that excessively long waits for NHS treatment are not acceptable. That's why we're determined to reduce patient waits in the year ahead, and our investment of £106 million of additional funding will help us to deliver more than 150,000 extra appointments and procedures in 2025-26. This includes £25 million for orthopaedics and more than £12 million for ophthalmology. This funding is just part of our record investment of £21.7 billion for health and social care this year, which will expand capacity and reduce waiting times.
Jackie Bailey.
Scots are forking out thousands of pounds, some having to use personal savings or borrow from family members to pay for cataract procedures, hip and knee replacements and even rounds of chemotherapy. I hear what the Cabinet Secretary says, but actually it's a lot of words that cover up the incompetence of this SNP government. So when will the Cabinet Secretary accept that after 18 years of the SNP in charge, Scots are faced with the reality of a two-tier health service in Scotland?
Cabinet Secretary.
So I've set out and I've always been candid with the challenges that our healthcare systems face here. These are not unique challenges to Scotland. They are unacceptable in anybody having to wait too long for their health care to be provided. But we know that the situation with regards to private health care utilisation in Scotland is much smaller than where other parts of the UK are concerned. So in England, for instance, when you combine the insurance-paid admission rate with the uptake of private health care, we are seeing 1,445 admissions per 100,000 in England. That compares to 902 in Scotland. These are facts that I know Jackie Baillie looks to distance herself from her Labour government's performance, but they are facts and a reality that demonstrate there are shared challenges across the UK in responding to the situation that arose during COVID. We have a plan to deliver for the people of Scotland, and we intend to deliver against it.